Well, maybe this is a good time to then shift to sort of a little bit more of the nitty gritty of what this Deloitte Health Equity Institute is about. Could you just fill us in exactly when it was created, about how many people work for it, and maybe a project or two that the Institute is taking on?
I'd be happy to. So maybe I'll start with saying that, Deloitte as an organization has been doing many things to advance health equity for decades, right? So this is not a brand new idea, but the recent events and what's happened has really made us look at ourselves to say, how can we truly be impactful in society? And so we established the Health Equity Institute March of this year, 2021. And the way we define it is that it's a new social innovation and knowledge development organization that moves the field for public good and advances equity as an outcome. Now, every single word is selected very intentionally, which is to say that we as business leaders and professional services firm believe that if you can define an outcome and organize around it and create frames around it, that you can advance it. So our main objective is exponential change. How do we drive exponential change through pro bono programs, philanthropy, and cross-industry collaboration? You asked earlier, these intelligent, idealistic, well-minded people, not just in medicine, but actually all business leaders, community leaders, government leaders. And we believe that we have the platform to pull them together. So a couple of examples of that, we're working with United Way to increase COVID vaccination rates among communities of color. And we're increasing access to it, awareness, education at local community and faith-based centers in the Washington area. We're working with Mary's Center, where the COVID cases per capita have been disproportionately high. And once again, we're increasing access to vaccination. And then the other thing that we're doing is we're working with Lurie Center for Children, really to look at what's the burden on students and teachers as a result of COVID-19. So that's just three small projects that we're doing. We actually have over 15 collaborations, both with academic medical centers, HBCUs, which are the historically Black colleges and universities. And really, we believe that our power is that we can provide data-backed ways of approaching this issue. And we have partners and business leaders who are willing to hold hands and link arms with us to make change.
Could you unpack what you mean by work with exactly? So, my vision of Deloitte is, healthcare. A hospital is having financial problems, and it comes in and analyzes and figures out, well, this surgical service is inefficient, and you could expand this service, and so on and so forth. That something is sort of not running right, and you look at it with data and sort of can steer the leadership of the organization to sort of solve the problem. So is that the way you're working in this realm too? It's sort of the outside eyes with a lot of data and spreadsheets, and telling folks, advising folks, I guess telling could be a little freighted, but advising folks, well, you really, you could try it this way, and maybe, so I'm just wondering if it's the same sort of interaction, sort of transaction.
There's definitely some of that, but within the Institute, we're approaching things in three critical ways. One, we are actually partnering to implement programs that we believe will advance health equity. And we're doing that with partners. So they could be health plans, healthcare providers, not-for-profit community organizations. And we're both providing, financial dollars to invest in order for the work to be done, as well as giving the time and resources of our talented, high competency folks to actually help go and implement the program. So that's one way. The other thing that we're doing is we're spending quite a bit of time collating data in order to provide insights that make a difference. So for example, we have on our website access to, if you're a provider organization, trying to understand which of my communities are most impacted, and being able to click through and understand, who's most affected, where are the largest vulnerable communities. And so we're providing data and insights. And then finally, the third way we're advancing health equity is by creating a knowledge hub that actually democratizes it. So we worked with a large academic medical center, for example, to set up a testing site at a public housing area. And what we did is not only did we do that project as far as a community partnership, but we created a playbook of how do you actually go from identifying where to set up the vaccine or testing to what are the steps that you need to do logistically, how many people do you need, what's the staffing model, and those playbooks are available for no cost within our website. And so we're trying to empower and enable others as well.
Now, you also, maybe I didn't hear this quite right, but are you also working, or is there work in this area where healthcare, as you know, is metrics driven? And so are you developing, or are others developing metrics that would begin to measure health equity outcomes and in some sense make organizations accountable for meeting those metrics in the same way you referenced value-based care, they're held to account for the number of patients who get a beta blocker after being in the emergency room for a cardiac event. So is that part of what you're working on as a
100%.
if it doesn't measure, if you can't measure and it doesn't exist,
I couldn't agree more with you on that. And I think that, so we are developing a health equity index, and we've helped a number of organizations create a dashboard for their own organizations, both in terms of looking internally and saying, in terms of diversity, equity, and inclusion, does our workforce actually represent, and our internal practices of the organization advance equity? We've looked at the offerings and services that you have. You mentioned, adherence to beta blockers, but where are our clinics located? What are the operating hours? Does that reflect the needs of the community? And then we've looked at data, also looking at how are we, where are our data gaps if we're really to understand, how race, gender, geographic area really impacts disparities and outcomes. And then, within this, Peter, the thing that I would highlight is there's a conventional wisdom or a myth that we're really trying to debunk, which is that if you want to advance health equity, you have to do it as a public good only, as a program and initiative, and it erodes your bottom line. And so we're actually focused on saying, here is how health equity can actually be the basis for competition, especially within the healthcare industry. And so we've worked with health plans. CMS actually just announced that health equity is going to be centered to their value-based care. And so when you're looking at quality, we're actually helping tease out, yes, it's important to have overall adherence to whatever treatment protocol, but then can you break that up to say, are there disparities that you can have 80% adherence in one group, or lower mortality, but in another group it could be 50 or 30. And so we're helping define that. And then the final piece I'll say on that is, for those areas where there are disparities, the assumption is it's going to cost you more to solve it. And we've done the math. Other organizations have done the math that disparities actually cost all of us more money, and it's more expensive. And so you can actually use it as a business strategy that on how to win and how to become more profitable if you figure out ways to advance health equity.
Yeah, so I guess you're saying that the ROI on addressing health disparities might be pretty good.
It's fantastic.